Una niña de 13 años no está preparada.
Muchas piensan, a mí no me va a pasar.
Eso es algo real, eso es algo que está ahí.
Se podría considerar como una epidemia en la región latinoamericana.
¿Es muy común?
Sí, en realidad sí.
Este es un problema que nos concierne a todos.
Cassandra, ¿es el momento para ser mamá?
Unequal access to quality health services for mothers, babies, and adolescents in Latin America is an important challenge. Mesoamerica is one of the most unequal regions on the planet. Indigenous women are 3 times more likely to die during pregnancy, birth, or postpartum. Access to quality maternal care could prevent 1 of every 2 maternal deaths. In Latin America, the poorest teenagers are 3 to 4 times more likely to become pregnant compared to the richest quintile. The child of a mother without education is 3 times more likely to die before its first birthday. What if we could improve lives of these women, adolescents, and babies by supporting governments to improve their effectiveness, efficiency, and quality of care through revolutionary blending financing and management models? Answering this question is at the heart of the Salud Mesoamerica Initiative, an innovative public-private partnership. The Inter-American Development Bank joined forces with public and private sector partners to create an alliance where strengths and resources of the partners complement each other to close the health equity gaps and prevent needless deaths in 1.8 million women and children of the poorest 20% of Mesoamerica. Salud Mesoamerica focuses on collective impact, measurable results, and government's commitment and ownership. It brings together the innovation, financing, and expertise of the Inter-American Development Bank, the Bill and Melinda Gates Foundation, the Carlos Slim Foundation, the governments of Canada and Spain, and 8 governments of Mesoamerica. The initiative innovates by implementing a results-based financing model in which countries and donors share the costs and the risks. When countries achieve 80% of the coverage and quality targets, they receive a cash incentive equal to 50% of their contribution. After 9 years, the results have been remarkable. Improvements in coverage and quality of care have reduced the health equity gap, bringing health care for the poor closer to and sometimes above the national average. For example, in Honduras, hospital births increased from 76% to 90%, surpassing the national average of 83%. In Costa Rica, a reduction of 11.4% in adolescent fertility can be directly attributed to Salud Mesoamerica's intersectorial approach. In El Salvador, there is an increase of 35% in preventive checkups, resulting in a reduction of 12% in hospitalizations attributable to Salud Mesoamerica. In Nicaragua, quality of routine neonatal care improved by more than 35 percentage points. Or in Belize, the application of oxytocin to prevent deaths due to bleeding after childbirth increased from 60% to 99%.
Salud Mesoamerica has the lives of children and women at heart. They are the passion that drives our actions. Salud Mesoamerica has proven to be a successful mechanism to close the health equity gaps. We all have experienced the power of the partnership and the importance of developing a trusted and transparent relationship to solve problems together. We all have experienced the transformational force of governments, their leadership, their ownership to make changes in their populations. We have come back to the basics, listening to the people's needs and paying attention to the community practices and knowledge.
The Salud Mesoamerica Initiative model could be scalable and adaptable to any region in the world and to other sectors. It empowers governments and citizens to trigger life-changing opportunities, contributing to ending generational cycles of poverty and preventing other consequences like marginalization, violence, or forced migration.
When women do not have access to healthcare services, people's lives are affected. Dear members of the jury, We are not talking about cases. We are not talking about numbers. We are talking about people.
You could be talking about me.